am Sarah Kucharski. I am a patient with fibromuscular dysplasia, and I'm happy to be representing the patient experience at Doctors 2.0 in 2012. An e-patient is someone who is engaged and empowered and who's making use of social media such as Facebook, Twitter, blogging to really interact in their healthcare experience. It's someone who has also taken responsibility for their own healthcare and chooses to help make decisions rather than just have decisions made for them. Patients, doctors, caregivers are really coming to the table and having these discussions. It's changing the face of healthcare so that it's less of something that simply happens to the patient and more of something that they can be involved in. Well, I got involved in being an e-patient because my own disease is a rare disease, and rare disease patients really don't have the luxury of bumping into another patient who has their disease, and so we have to reach out more, and using social media really allows us to do that and transcend any sort of geographic boundaries so that we can find a community and make a community for ourselves. I am a blogger. I also am running the FMD Chat social community, which is a peer-to-peer support group for those who are affected by fibromuscular dysplasia. Very first time that I met a fibromuscular dysplasia patient was actually on the Mayo Clinic social boards, and there was a post that I really recognized the language in as being my own symptoms, and contacted the patient and found out that, lo and behold, we had the same disease. And it was from talking to her and getting connected with other patients and really seeing the need for patient support that we had the idea to just start this social media group that would be able to connect all the patients and use one another as a resource. To be a chronic disease patient, there's so much that really goes along with it. There are many different issues that come into play, from even just dealing with the disease, but also dealing with the more long-term effects such as depression and working with a caregiver, and really seeing this as something that's not just a one-time event, that it's going to be a life-changing sort of illness. And using the internet to reach out to people and find people that you can connect with to help you go through that is a really powerful experience. But one of the things that patients really need to remember is that not all of the information that's on the internet is trustworthy information. And so to really vet your sources and look for sites that either are honor code endorsed, which means that they abide by some of the more strident rules for providing good healthcare information, hospital sites, not just any old site that you'd find out there. And if you have questions about it, you can always ask your doctor. Take that information, ask what the doctor thinks about it, so that it is a discussion of the information that you find and that you're not doing anything that would ultimately harm your health. I think patients in the future are going to be more involved, going to be more participatory, and hopefully are contributing to the development of healthcare resources, whether it be drug treatments, patient resources, research, just contributing as actual pieces of the process rather than just something that healthcare happens to. And for myself in the future, I want to be participating in research as well and making a difference for those patients who have my disease and others. Because rare disease patients, as individual disease communities, we're very small, but as a whole, rare diseases can represent a huge number of patients, and there's even talk that the rare disease community represents more than cancer and AIDS combined. As an advocate, I want to be someone who helps all patients. It's not just a matter of rare disease. My own patient experiences are ones that have given me a lot of perspective on the issue, even at a young age, and so sharing that knowledge is something that if I can help people kind of understand their own illness and what I've gone through and maybe make it a little bit easier for them, then that makes everything that I've gone through seem more worthwhile. Doctors have a lot of responsibility right now to decide whether or not they're going to accept the e-patient movement. It's happening whether they like it or not, and they get to make a choice about whether or not they embrace it and learn from it or fight against it. We can work together to change the system for the better, because when you have a problem, you can look at it from the inside and you tend to have the same kind of thought processes that have always existed. But if you bring in new players to the table who ask the questions that maybe haven't been asked before, then you can find some innovative solutions to solve the problem. The patient is someone who's kind of new at the table in terms of providing some of these solutions. There have been already really interesting projects where, like recently, a children's hospital was designed with using children on the advisory board, asking them what they would want to see in a hospital. And so it's that kind of participatory model of asking the people who are affected by the healthcare system what they would like to see in it, what they would like to change. One of the things that often comes up in the e-patient movement is the doctor-patient relationship and how it can improve communication. And so much of that is being an active listener, both on the doctor's part and on the patient's part, so that you have a dialogue going on and that it's not just one way. Improving that dialogue, using these listening skills, using empathy to connect with one another, that will overall improve the patient experience and really improve the doctor experience as they hopefully have a more rewarding career with patients who are engaged, compliant, and ultimately healthy.